Welcome to the Omnidental and Med Spa podcast. Today we're embarking on a deep dive into a topic many of you have probably heard whispers about. Same-day dental implants. Are they right for you? It sounds almost too good to be true, doesn't it? Like a quick fix for a missing tooth. We're here to unpack exactly what they are, who they're for, and how they stack up against traditional options, separating the hype from the reality.
It's truly one of the most exciting shifts we've seen in modern dentistry. It really makes the process of tooth replacement much faster and more convenient than ever before. What's fascinating here is how these immediate solutions can profoundly change a patient's experience, providing not just function, but also, significant psychological and aesthetic benefits almost instantly. We're going to guide you through the details, help you understand the real benefits and considerations, and maybe quiet some of those whispers with solid information.
Absolutely. And before we really dive in, just a quick note about where advanced care like this is made possible. Omnidental and Med Spa. They're located right in the vibrant community of Arlington Heights, IL.
That's right. Omnidental and Med Spa, led by Dr. Bayless Poles, is dedicated to top-tier dental care. They offer a full spectrum, general and cosmetic dentistry, including these advanced treatments like various dental implant options. And beyond just oral health, they also provide a comprehensive range of aesthetic services. It's truly a patient-centered approach to overall health and well-being, serving not just Arlington Heights, but also nearby communities like Buffalo Grove, Palatine, and Schaumburg.
Excellent. So let's peel back the layers on this.
Yeah.
Many of our listeners know the traditional dental implant process, right? It can involve months of waiting. So when we talk about same-day dental implants, what's the core innovation? What allows for such a dramatically compressed timeline, and what exactly does same-day mean for the patient?
That's a really crucial distinction to make, because same day doesn't quite mean you walk in and, walk out with your final permanent tooth ready for a steak dinner. What it does mean is that within a single visit, a highly skilled professional can perform the tooth extraction, place the actual implant post into the jawbone, and then immediately fit you with a temporary crown.
Ah, temporary. That's the key word.
Exactly. This provides an instant cosmetic result. So you don't leave the office with a noticeable gap or an empty space where your tooth used to be. It's a remarkable streamlining of what was, traditionally a multi-stage, drawn-out process.
So no walking around with a visible gap. That's huge psychologically, right?
Yeah.
I mean, nobody wants to hide their smile for months while waiting for healing, especially if it's a front tooth. That immediate look must be a game changer for a lot of people.
It truly is, yeah. The confidence boost from having that temporary tooth in place right away can be just immeasurable for some patients. This immediate placement concept significantly streamlines the entire journey compared to traditional implants. Those often require multiple surgical appointments spaced out over several months. Think about it. Extraction, then maybe weeks or months for healing, then implant placement, more months for the bone to integrate, and then finally you get a crown. Same day really consolidates those initial steps. So the core question becomes, who is the ideal candidate for this kind of accelerated process? And what are maybe the less talked about advantages that really set these same-day implants apart?
That immediate aesthetic appeal is definitely a big draw. But beyond just, not having that gap, what are the core advantages? What makes same-day implants so appealing? Like, why would someone choose this over the traditional way if they could potentially just wait it out?
Well, if we connect this to the bigger picture, patient comfort, convenience, and overall oral health, the benefits are quite compelling for the right candidate, of course. Firstly, you get faster results, like we said, immediate placement of the implant and that temporary crown. This means you don't have to deal with a visible gap or the maybe inconvenience of a removable temporary thing during that initial healing phase. That's a huge win for confidence and just daily life, especially for people with public-facing jobs or, important social events.
Makes sense.
Secondly, reduce appointments. This procedure basically bundles the tooth extraction, the implant surgery itself, and the initial temporary restoration all into one single visit.
One day. Wow.
Yeah, one day. That translates to significantly less time off work, away from family, or other commitments. It's a major convenience factor in our busy lives, isn't it?
Definitely. For some people, just juggling multiple appointments is a real barrier.
Exactly. Thirdly, patients often report improved comfort because it completely eliminates the need for things like removable partial dentures or those temporary flipper things during that initial healing period. Removable options can be, uncomfortable. They can shift, affect speech, even make eating tricky sometimes. Avoiding that is a big plus.
I can imagine.
Fourth, and this is really interesting, it actively preserves jawbone.
How does that work?
Well, what's fascinating is that placing the implant early, right after extraction, can actively support bone stability. See, when a tooth is lost, the jawbone in that spot can start to shrink or resorb because it's not getting stimulated anymore. Placing the implant immediately gives the bone something to work with, stimulating it and helping prevent that natural bone loss. This is a big benefit compared to traditional methods where some bone loss might happen while you're waiting for the next stage.
That's a great point.
And finally, unexpected durability. What's really remarkable is that even though it's faster, studies show the success rates for same-day implants are often indistinguishable from traditional methods. We're talking frequently over 95% success when done on the right candidates by experienced dentists.
Really? Over 95%?
Yes. It challenges that old idea that quicker automatically means, less sturdy. It's not about compromising quality for speed. It's really an advancement in technique and the materials we use now.
Those benefits paint a very appealing picture. It sounds like a truly modern, efficient solution. But, okay, here's where we need to dig a little deeper, beyond the headlines and into the, let's say, the fine print. No advanced procedure is perfect for everyone, right? So what are the non-negotiables, the potential downsides? And who specifically makes this a success story? Is this really for everybody?
That's a critical point for you, the listener, to understand. While same-day implants sound amazing, they're definitely not a universal fix. There are some important things to consider and specific criteria that absolutely must be met for it to work well and be safe. First, there are stricter requirements. Not every patient qualifies. You absolutely need good bone density in the jaw where the implant's going. Think of it like needing a strong foundation for a house. It's essential for immediate stability.
Right. The implant needs something solid to grip onto immediately.
Precisely. Also, there can't be any active infection in the area, and you must have healthy gums. These are absolute musts. Without these ideal conditions, the risk of the implant failing goes up quite a bit because it just won't have that clean, strong environment it needs to integrate properly.
Okay, so healthy mouth, strong bone. Got it. What else?
Second, it's vital to remember these are temporary crowns, only at first. It's crucial to really understand that the immediate crown is temporary. It's mainly for looks and maybe very light function. You won't be chewing steaks or biting into apples with it right away.
Ah, okay. So still need to be careful.
Definitely. The final permanent crown comes later, after the implant has fully healed and fused with the bone, which we call osseointegration. This means you still need to be mindful of your diet during healing, often sticking to softer foods for a while.
That makes sense. Healing still takes time.
Exactly. Third point, a healing period is still needed. While the initial placement is fast, the body's amazing healing process, that osseointegration we mentioned, you can't skip that. That's where the titanium implant actually fuses with your jawbone, becoming incredibly strong, like a natural tooth root.
Right.
That biological process still requires several weeks, maybe a few months, much like a broken bone healing. You can speed up the first steps, but biology has its own timeline for making things really solid.
Can't rush Mother Nature.
You got it. And finally, there can be slightly higher risks, potentially. While it's generally very safe when done correctly by a skilled surgeon, there's maybe a small increase in the chance of implant failure if post-op instructions aren't followed meticulously. Being careful with diet, keeping things super clean, avoiding smoking, all that is absolutely paramount to make sure the implant heals correctly and integrates successfully.
So given those important points, let's talk about the ideal candidate. Who should really be thinking about this as a, viable option for replacing a tooth? What makes someone a good fit?
Okay, so you might be a great fit if you meet certain criteria. This makes you an ideal candidate for this advanced procedure. Firstly, you're in good general health. And importantly, you don't smoke. Smoking really hinders healing and can dramatically lower the success rate of any implant, same day or traditional.
Okay, non-smoker, good health.
Secondly, you have that strong jawbone density and healthy gums we talked about. These are non-negotiables. The implant needs that solid foundation for immediate stability. Without enough healthy bone, it just won't work for same day.
Makes sense.
Thirdly, you typically need a single tooth replaced, or maybe just a few selected teeth, rather than like a full arch replacement, although techniques are evolving there too.
Yeah.
It's often best suited for more straightforward cases initially.
Gotcha.
Fourth, you specifically value faster cosmetic results and fewer appointments. If convenience and looking good quickly are high on your list, This option really aligns with those goals.
Right, the time-saving and aesthetic aspects.
And very importantly, you are comfortable eating a soft food diet during that initial healing period. This shows you understand the temporary crown isn't for heavy work and that the implant needs time to heal without being stressed.
Okay.
Ultimately, the very best way to know for sure is to schedule a thorough consultation with an experienced dentist or specialist that can look at your specific situation, your health history, use advanced imaging like CT scans to check your bone, and really talk through your goals to see if same-day implants are the right choice for you.
That truly makes perfect sense. It's definitely not one size fits all. But for the right person, the efficiency and the immediate results sound incredibly appealing. So let's put this into perspective now. For someone listening who's weighing their options, how do same-day implants directly compare side by side with the traditional approach? What are the key differences they should really be aware of?
Yeah, looking at them side by side is extremely helpful. Both are excellent options, but they serve different needs and situations. If we think about treatment planning and the patient experience, here are the main differences. First, treatment time. Same-day implants, the initial placement part, including that temporary crown, is typically done in one day. You leave the office with a tooth, cosmetically speaking.
Right.
Traditional implants, on the other hand, usually span several months, maybe up to 6 months or even longer sometimes. That's because of the multiple surgical stages and the needed healing time between each step.
So potentially living with a gap or a temporary removable thing for months.
Exactly. Now, regarding the temporary crown, with same day, you get one immediately after the implant is placed. Instant aesthetics, some light function, big confidence boost. With traditional implants, generally that's not the case initially. You might have that gap or use a removable denture until the implant is fully healed and fused with the bone.
Okay.
The healing period, though, is crucial for both. Both methods absolutely require time for osseointegration, that fusing of implant to bone. That biological process can't be rushed no matter how fast the first part was. It's needed for stability and long-term success.
Makes sense. The body needs time.
Right. The final crown placement timing is also similar, happening after healing. For both approaches, the final permanent custom-made crown is placed only after that initial healing period is complete and osseointegration is confirmed. That's when the implant is ready for full chewing function.
Okay, so the end result timing for the permanent tooth might be closer than people think.
The final crown timing, yes, is dependent on healing for both, but the initial experience is vastly different. Then there's the number of appointments. Same day usually involves significantly fewer appointments overall compared to the multiple visits needed for traditional implants spread across months. Big time saver, huge convenience factor.
Less disruption to life.
Absolutely. And finally, the need for a bone graft. A bone graft might be needed sometimes, but it's probably less likely to be a prerequisite for same-day implants because the procedure itself requires good existing bone for that immediate stability. It's perhaps more commonly needed with traditional implants, especially if a lot of time has passed since the tooth was lost and bone has resorbed, or if the patient's bone just isn't dense enough initially and needs building up first.
Okay, that comparison is really helpful. It highlights the trade-offs and the specific advantages of each. So this brings us to the long-term outlook. Once you've gone through the process, everything's healed up nicely. How durable are these same-day implants? What kind of care do they need to make sure they last? Because ultimately, you want a fix that stands the test of time, right?
Absolutely, that's the goal. Long-term success and durability are obviously paramount, and this is where, the science really shows its value. With proper care, same-day dental implants deliver excellent long-term outcomes, really comparable to traditional methods. The implants themselves are made from the same high-quality, body-friendly materials, usually titanium. They're designed for incredible strength and longevity once they've integrated with your bone.
So they should last just as long.
Generally, yes. The long-term success depends more on the patient's health, care, and the skill of the placement than the initial speed. To maintain that durability and make sure the implant lasts for many years, often decades, you absolutely must commit to vigilant oral hygiene. That means regular brushing, flossing, just like your natural teeth, and really importantly, consistent professional dental cleanings and checkups.
Those regular visits are key then.
They really are. They let your dentist monitor the implant, the gum tissue around it, make sure everything stays healthy, and catch any potential small issues before they become big problems. And it's also vital, especially during that initial healing phase, to strictly follow the dentist's post-op care plan, avoiding those hard foods with a temporary crown, being gentle, giving the implant the best chance to fuse properly without being disturbed. The The success rate stays consistently high, especially when the treatment is tailored to your specific needs and done by skilled professionals using, advanced dental tech.
What a journey through the world of same-day dental implants. It's really clear this isn't just some quick fix gimmick. It's a sophisticated treatment with significant, well-documented benefits. For the right person, of course. The immediate aesthetic results, fewer appointments, high success rates, they're certainly compelling, makes it a very attractive modern dental solution for people wanting efficiency without sacrificing quality.
Indeed. And this brings us to a crucial thought for you, our listener. How can understanding these advanced options empower you in your own oral health journey? Knowing these possibilities exist means you can have more effective conversations with your dental provider. You can ask informed questions and work together to choose the best path for your unique needs. It's about being an active participant in your health decisions.
Absolutely. Being informed is key. So if you're looking for fast, reliable tooth replacement, fewer visits, same-day dental implants could be a fantastic option. It could significantly improve both your smile and your quality of life without that long waiting period of traditional methods. The best way to find out if they're right for you, as we've said, is to schedule that consultation with a qualified provider.
And if you happen to be in the greater Arlington Heights area, Omni Dental and Med Spa, led by Dr. Bayless Poles, is an excellent place to start that conversation. They are equipped with advanced dental technology and have a very patient-centered approach, serving Arlington Heights and surrounding communities like Palatine, Buffalo Grove, Mount Prospect, and Schaumburg. You can contact them today at 847-483-8833, or you can schedule your appointment online through their website to discuss your specific needs.
And that's our deep dive for today. As you go about your day, maybe consider this. What other areas of healthcare do you think are ripe for this kind of accelerated yet reliable innovation? How might these advancements shift your expectations for medical or dental procedures in the future? Definitely something to mull over. Thanks so much for joining us.